Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A client with acute chest pain is receiving IV morphine sulfate. Which of the following results are intended effects of morphine? Select all that apply. 1. Reduces myocardial oxygen consumption. 2. Promotes reduction in respiratory rate. 3. Prevents ventricular remodeling. 4. Reduces blood pressure and heart rate. 5. Reduces anxiety and fear. The correct answers are 1. Reduces myocardial oxygen consumption. 4. Reduces blood pressure and heart rate. And 5. Reduces anxiety and fear. Morphine sulfate acts as an analgesic and sedative. It also reduces myocardial oxygen consumption, blood pressure, and heart rate. Morphine also reduces anxiety and fear due to its sedative effects and by slowing the heart rate. It can depress respirations. However, such an effect may lead to hypoxia, which should be avoided in the treatment of chest pain. Angiotensin-converting enzyme inhibitor drugs, not morphine, may help to prevent ventricular remodeling.
During physical assessment, the nurse should further assess the client for signs of atrial fibrillation when palpation of the radial pulse reveals 1. 2 regular beats followed by 1 irregular beat. 2. An irregular rhythm with pulse rate greater than 100. 3. Pulse rate below 60 beats per minute. 4. A weak, thready pulse. The correct answer is 2. Characteristics of atrial fibrillation include pulse rate greater than 100 beats per minute, totally irregular rhythm, and no definite P waves on the ECG. During assessment, the nurse is likely to note the irregular rate and should report it to the physician. A weak, thready pulse is characteristic of a client in shock. 2 regular beats followed by an irregular beat may indicate a premature ventricular contraction.
The nurse should assess the client with bladder cancer for which of the following? 1. Suprapubic pain. 2. Dysuria. 3. Painless hematuria. 4. Urine retention. The correct answer is 3. Painless hematuria. Painless hematuria is the most common clinical finding in bladder cancer. Other symptoms include urinary frequency, dysuria, and urinary urgency, but these are not as common as hematuria. Suprapubic pain and urine retention do not occur in bladder cancer.
Which one of the following children is at most risk for sudden infant death syndrome? 1. Infant who is 3 months old. 2. 2-year-old who has apnea lasting up to 5 seconds. 3. Firstborn child whose parents are in their early 40s. 4. 6-month-old who has had 2 bouts of pneumonia. The correct answer is 1. The highest incidence of SIDS occurs in infants between ages 2 and 4 months. About 90% of SIDS occurs before the age of 6 months. Apnea lasting longer than 20 seconds has also been associated with a higher incidence of SIDS. SIDS occurs with higher frequency in families where a child in the family has already died of SIDS, but the age of the parents has not been shown to contribute to SIDS. A respiratory infection such as pneumonia has not been shown to cause a higher incidence of SIDS.
The nurse is teaching a diabetic client using an empowerment approach. The nurse should initiate teaching by asking which of the following? 1. How much does your family need to be involved in learning about your condition? 2. What is required for your family to manage your symptoms? 3. What activities are most important for you to be able to maintain control of your diabetes? 4. What do you know about your medications and condition? The correct answer is 3. What activities are most important for you to be able to maintain control of your diabetes? Empowerment is an approach to clinical practice that emphasizes helping people discover and use their innate abilities to gain mastery over their own condition. Empowerment means that individuals with a health problem have the tools, such as knowledge, control, resources, and experience, to implement and evaluate their self-management practices. Involvement of others, such as asking the client about family involvement, implies that the others will provide the direct care needed rather than the client. Asking the client what the client needs to know implies that the nurse will be the one to provide the information. Telling the client what is required does not provide the client with options or lead to empowerment. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Several nurses complained to the nurse manager that one of the nursing assistants constantly takes extensive lunch breaks. Which should the nurse manager do? 1. Convene a group meeting of all the nursing assistants to review their responsibilities related to time management. 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. 3. Arrange a meeting with the nurses so that they can confront the nursing assistant as a group. 4. Document the nursing assistant's behavior and place it in the aides personnel file. The correct answer is 2. Talk with the nursing assistant to explore the reasons for the behavior and review expectations. Rationale. Recognition of a problem is the first step in the problem-solving process. Once the unacceptable behavior is identified and acknowledged, then the reasons for the problem can be explored, solutions suggested, and expectations reinforced. In option 1, it is the nursing assistant who is late and takes extensive lunch breaks who needs to review the responsibilities related to time, not the nursing assistants who follow the rules. It is not the responsibility of others to confront the employee who is late for work and takes extensive lunch breaks. The employee reports to the nurse manager, who is superior in the chain of command of the organization. The nurse manager should meet with the employee. In addition, counseling sessions with employees should be confidential and conducted in private. Option 4 is premature. The nurse manager first should implement an action identified in another option.
A 60-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? 1. Tachycardia. 2. Weight gain. 3. Diarrhea. 4. Nausea. The correct answer is 2. Weight gain. Typical signs and symptoms of hypothyroidism include weight gain, fatigue, decreased energy, apathy, brittle nails, dry skin, cold intolerance, hair loss, constipation, and numbness and tingling in the fingers. Tachycardia is a sign of hyperthyroidism, not hypothyroidism. Diarrhea and nausea are not symptoms of hypothyroidism. One day following a subtotal thyroidectomy, a client begins to have tingling in the fingers and toes. The nurse should first 1. Encourage the client to flex and extend their fingers and toes. 2. Notify the physician. 3. Assess the client for thrombophlebitis. 4. Ask the client to speak. The correct answer is 2. Notify the physician. Tetany may occur after thyroidectomy if the parathyroid glands are accidentally injured or removed during surgery. This would cause a disturbance in serum calcium levels. An early sign of tetany is numbness and tingling of the fingers or toes and in the circumferal region. Tetany may occur from 1 to 7 days post-operatively. Late signs and symptoms of tetany include seizures, contraction of the glottis, and respiratory obstruction. The nurse should notify the physician. Exercising the joints in the fingers and toes will not relieve the tetany. The client is not exhibiting signs of thrombophlebitis. There is no indication of nerve damage that would cause the client not to be able to speak.
The nurse is preparing the client for cardioversion. The nurse should do which of the following? Select all that apply. 1. Explain the procedure to the client. 2. Place a self-adhesive patch between the skin and the paddles. 3. Place the paddles over the client's clothing. 4. Call clear before discharging the electrical current. 5. Record the delivered energy and the resulting rhythm. The correct answers are 1, 2, 4, and 5. The nurse should first explain the procedure to the client, and then place the patch electrodes per agency procedure. The nurse must make sure to call clear before discharging the electrical current to prevent injury to others who may be helping with the procedure. After the procedure, the nurse must record the amount of electrical current delivered and the resulting rhythm. The paddles are placed on the patch adhered to the client's skin, not over the client's clothing. A client who has had the jaws wire begins to vomit. What should be the nurse's first action? 1. Insert a nasogastric tube and connect it to suction. 2. Use wire cutters to cut the wire. 3. Suction the client's airway as needed. 4. Administer an antiemetic intravenously. The correct answer is 3. The nurse's first action is to clear the client's airway as necessary. Inserting an NG tube or administering an antiemetic may prevent future vomiting episodes, but these procedures are not helpful when the client is actually vomiting. Cutting the wires is done only as a last resort or in case of respiratory or cardiac arrest.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client is diagnosed with expressive aphasia. Which psychosocial client problem would the nurse include in the plan of care? 1. Potential for injury. 2. Powerlessness. 3. Disturbed thought processes. 4. Sexual dysfunction. The correct answer is 2. Powerlessness. Expressive aphasia means that the client cannot communicate thoughts, but understands what is being communicated. This leads to frustration, anger, depression, and the inability to verbalize needs, which, in turn, causes the client to have a lack of control and feel powerless. Which finding might delay a cardiac catheterization procedure on a 1-year-old? 1. 30th percentile for weight. 2. Severe diaper rash. 3. Allergy to soy. 4. Oxygen saturation of 91% on room air. The correct answer is 2. Severe diaper rash. A child with severe diaper rash has potential for infection if the interventionist makes the standard groin approach. Option 1 and 4 may be a reason the child needs catheterization. Shellfish, not soy, is an allergy concern. Which action would best demonstrate evidence-based nursing practice in the care of a patient who is 1 day postpartum and reporting nipple soreness while breastfeeding? 1. Inform the mother that a certain amount of soreness is normal. 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. 3. Advise the use of a breast pump until nipple soreness resolve. 4. Advise alternating breastfeeding and pumping to avoid excess sucking at the nipple. The correct answer is 2. Assess the mother-baby couplet for nursing position and latch and correct as indicated. Improper latch and position are the most common causes of nipple soreness and can be corrected with assessment and assistance to the mother. This practice supports the perinatal core measure of increasing the percentage of newborns who are fed breast milk only. Advising the mother that soreness can be normal does not provide any assessment or assistance to the mother with her problem. Using a pump may be appropriate at some times during lactation, but the first priority is to assess and correct the issue that is causing the soreness. A 34-year-old female is diagnosed with hypothyroidism. The nurse should assess the client for which of the following? Select all that apply. 1. Rapid pulse. 2. Decreased energy and fatigue. 3. Weight gain of 10 pounds. 4. Fine, thin hair with hair loss. 5. Constipation. 6. Menorrhagia. The correct answers are 2. Decreased energy and fatigue. 3. Weight gain of 10 pounds. 5. Constipation. And 6. Menorrhagia. Clients with hypothyroidism exhibit symptoms indicating a lack of thyroid hormone. Bradycardia, decreased energy and lethargy, memory problems, weight gain, coarse hair, constipation, and menorrhagia are common signs and symptoms of hypothyroidism.
An 11-year-old is admitted for treatment of an asthma attack. Which of the following indicates immediate intervention is needed? 1. Thin, copious mucus secretions. 2. Productive cough. 3. Intercostal retractions. 4. Respiratory rate of 20 breaths per minute. The correct answer is 3. Intercostal retractions indicate an increase in respiratory effort, which is a sign of respiratory distress. During an asthma attack, secretions are thick, the cough is tight, and respiration is difficult. If mucus secretions are copious but thin, the client can expectorate them, which indicates an improvement in the condition. If the cough is productive, it means the bronchospasms and the inflammation have been resolved to the extent that the mucus can be expectorated. A respiratory rate of 20 breaths per minute would be considered normal and no intervention would be needed.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.